So this nicely tees up our next panel, which is going to talk about engagement of multi-sector actors. So I'm going to hand things off to Dr. Jamie Chriqui, who's going to be moderating this panel. Dr. Chriqui is Senior Associate Dean and Professor of Health Policy and Administration at the University of Illinois at Chicago. And she also serves as one of our terrific co-chairs for the planning committee of this workshop series. So thank you so much, Dr. Chriqui. I'll hand things off to you.
Thanks very much, Dan. It's a pleasure to be here today. I'm really thrilled to be moderating this next panel. Some of my favorite people in this space are on this panel, and I'm excited to learn from them. So this next panel is going to take us to the next sort of phase of one of today's goals, and really focusing on, working across sectors, learning more about their experiences with their work, and how do you integrate whole of community actors in policy systems and environmental change interventions. I'm joined today by Dr. Brian Saelens from the University of Washington Medical Campus Seattle Children's Research Institute, Deborah Parra-Medina from the University of Colorado Anschutz Medical Campus, and Dr. Laska at University of Minnesota School of Public Health. So without further ado, I'm going to turn it right over to Dr. Saelens. Thank you.
Thanks, Jamie. Thanks for the chance to be part of this panel. I appreciate the invitation. My work straddles the family-based intervention for childhood obesity space and the critical need to change policy systems and environments in which families and children are seeking to make healthy food choices and activity choices. The caregivers, larger family, friends, and community of children want children to be healthy, happy, safe, and thriving. And I try to help make this happen too. I've been an investigator in the space for 20 years and a member of my Seattle King County community for the past 18 years. Next. I have no financial disclosures or conflicts of interests, but I do say that multi-sector engagement results will vary because I bring my own professional and lived experience. Both mark my identities and experiences of privilege, luck, and mostly some great fortune in mentors, partners, collaborators, and colleagues. I'm fortunate to have met my life partner in college who eventually brought us back to a place in the Northwest that acknowledges systemic inequities, disparities, and racism and other disenfranchisement that requires policy systems and environmental interventions. We are, and I am, imperfect in this recognition and too slow in implementing equity solutions, but there's interest in some actions where I live. I'll talk about my experience, particularly what my partners have taught me. You may already know and practice these things, or the specifics may not apply to your context, but I hope some of these themes resonate, and the examples are detailed enough you can imagine how you do it in your context. I have and hope to challenge myself and you with questions throughout my presentation about what multi-sector work might look like. Next. First, let's start with academic and what I call academic adjacent partners. Think about the folks that work in and feel comfortable in buildings like this. Next. I didn't receive any training as a health psychologist in policy systems and environmental change or evaluation of such changes. I need academic partners in other disciplines, including urban planning, transportation, epidemiology, spatial expertise. My work in active transportation could not be done without them. And I distinctly remember reading their work while in postdoc training, but not able to do what they do or know what they know. So in my academic partnerships, I try to create the space where each partner brings their discipline, perspective, and expertise. To me, this has been most fruitful when we're focusing on a specific project, but I know that others foster and encourage multidisciplinary dialogue and conversation without a specific project, at least to start. Examples of some of ours have been the examination of the impact on physical activity of a new light rail transit line and the start of bus rapid transit. It's interesting in those two examples, our light rail transit line implementer didn't have a lot of interest in partnering with us, but our bus rapid transit partner did. So sometimes potential partners are just not interested. Within academic partnerships, in addition to the value of the project itself, I think it's also critical to know what else is valued by your different academic partners. My colleagues got credit within their academic disciplines for more student engagement, being able to bring outside disciplines into their lecture teaching, and of course, funding. So we paid attention to these things. As an example, on the bottom right, within our light rail project, we collected extensive device-based data on physical activity and where it occurred via GPS. And a graduate student of my colleague was interested in parks and used our data in combination with other spatial data to conduct various analyses related to parks, looking at use, visitation, associations. We could not have anticipated we would use our transit project to focus on parks, but it was valuable to the student to my colleagues, and the project overall. Next. I also think about partners who are academic adjacent, that is, those who are similar enough culture of valuing data, analysis and dissemination of such data, who are part of and work within existing systems. I've had the fortune of partnering with our local health department, Public Health Seattle and King County, mostly continuously for the past 16 years. This work has included research on the implementation and impact of nutrition labeling on menus, illustrated above, and the implementation and impact of Seattle's sugary beverage tax. This collaboration has also included me being a minor partner in a community-based participatory research project. This project focused on increasing physical activity in public housing communities. And I was there in the role of being the accelerometer expert and doing the processing of that data. They found that helpful and useful, so I served in that way. Collaboration with our local health department has also occurred at a larger organizational level for me and moved beyond research. My organization has been fortunate to partner on now 4 CDC-funded projects focused on health improvement initiatives. And these are not research per se, and I'll talk about them more a little bit later. My question to you is, what unique value do you bring to your academic partners and partnerships? Next. The vision for our communities, in particular our historically disenfranchised communities, is to be more thriving. We need to find that sweet spot where that vision overlaps with our research. Some of the challenges we've encountered include the finite time period for projects and funding. As an example, our nutrition labeling and our bus rapid transit work only demonstrated health behavior impacts years after a policy or an infrastructure change. And we were actually fortunate we got a late start, so our funding actually covered that longer follow-up period. But how can we do that more intentionally? Also, I'm painfully aware that the next project my partners might want to do may need different expertise, and this expertise may not be mine. So how have you helped your academic and academic adjacent partners build other relationships with diverse research colleagues in an effort to bring about thriving partnerships and a thriving community? Next. It can be difficult to find sustained, strong academic and academic adjacent partners, but that may be the easy part. It's likely more difficult to find, engage, and cultivate partnerships with real community. That is with community-based organizations, community leaders, and community members. And there's lots of reasons why this might be more difficult, including historical or current trauma, or at least hesitation around research and data due to exploitation of a community or similar communities in the past. What you bring as a researcher may not be particularly valuable to that community leader or community member at the time. And we may not share the same immediate currencies, incentives, or value. Next. In my experience, 2 things have helped the most. And again, I do them imperfectly, but they are being authentic and being more trustworthy. These, of course, need to be part of your academic and academic adjacent partnerships too. But I think in community partnership, it's particularly critical and needs to be more robust, more transparent. And this is not just talk, but demonstrating that you are deeply committed to the health of your community in ways that perhaps have little or nothing to do with your research. Are we volunteering time in the community? Are we known for being there and showing up? How are we otherwise serving our communities? As researchers, we exist within institutions with history and power, some of that hopefully good, but some of it likely bad. We need to acknowledge this power and privilege. I show up in spaces as a white, currently abled, cisgender, hetero person from a middle-class background. I need to acknowledge this and be mindful of my impact, how I show up, what are my biases, how can I serve rather than extract, and recognizing that different people may need to do more or less of this. And honestly, we as research leaders need to bring in more people who have to do less of this because they grew up and are from our diverse communities. The problem is not the community is mistrusting, but rather that as individual researchers and a research community, we need to be more trustworthy. And I think this can be built by providing substantial benefit based on what the community defines as benefit, not what we define as benefit. If you have the ability to donate time, financial resources, give your personal time and money to your community partners and the communities they serve, and ask for your institutions to do the same. Next. Make yourself and your resources available to your partners beyond the project and upon their request. Have you been to a city or a county council meeting or other decision-making meetings with your community partners? Have they asked you to provide comment? Are you serving on their boards? Are you asking them and compensating them for serving on bodies that advise how your research institution does its own work? We have a strong standing community advisor council that is not specific to a project, but rather provides community perspectives on how we can do our research more equitably. These community members have pointed out to us, it seems odd that we're paying them to tell us what we're doing not well. And they've been doing that for over 7 years. As in this top picture, have you wondered, acted, and funded your partners how to start the work of transforming a golf course and a covered driving range into a farm that provides fresh produce for local food banks? There's a farmer, public health practitioner, local health at King County Coalition program manager, communications lead, and me in this picture. And we're about to extract some pretty invasive plants and to get filthy. Unfortunately, I don't have an after picture. You need to be invited into these spaces where most or all people don't share your academic, or identity backgrounds, as in the picture below, and figure out how do you serve rather than lead in these spaces. We have been called out by our community partners for establishing partnerships that are inequitable. We've been calling it three-legged stool, and they said it's only two-legged and it's imbalanced. It's painful for us to hear, but grateful they trusted us and the partnership enough to say, and this stuck to us. And we apologized and we worked to make things better. We need to listen deeply. We also need to bring and share and eat food together. We're food researchers, we know this. Next slide. I mentioned before, we had a partnership focused on health improvement with our public health department. And that partnership also includes a coalition of community-based organizations focused on healthy eating, active living, and healthy environments. This work is focused on PSE change and programmatic implementation. The primary goal is not research, and we have been deeply engaged. However, we've also done things that evaluated things that have the potential for generalizable knowledge, resulting in various publications, our currency, about these actions and impacts. Some of the critical parts of this partnership we believe that have contributed to longevity include we've learned and evolved about shared governance and what power looks like in our collective decision-making. We've been very intentional about those conversations, we've documented them, and we now lean toward more of the community coalition side. Our funding allocation has shifted more toward our community partners and implementing organizations, and we have products that are valued by our community. And some of these happen to be research projects. The publication on the bottom derived from a Youth Mobility Justice Fellowship Training Program that was developed within our community-based organizations by the second author, Regina Dev. The rest of the authors were youth in the training program and were from our focus communities. And the first author was interested in pursuing graduate training in public health, in part based on their fellowship training experience. They were eager to pursue these things that supported this and their future public health career. And I can help with manuscripts. That's something I can do. The manuscript was a result of this interest and a shared value of documenting process and impact. They were instrumental in bringing zero youth fares for transit to our region. Next. Things I've said today hopefully resonate with some folks who have trained and engaged in community-informed research. Maybe it's not new. I encourage folks to start small and start with a conversation. Who in your community is already doing the healthy, happy, safe, and thriving work? Ask first how you can serve. I'm always challenged with even knowing about all the potential partners in our area. For example, a local initiative we have in our county focused on Best Starts for Kids funds over 200 community-based organizations. But I've also found that they know each other and they can be very helpful in helping you narrow our search and also reminding you how small your local world actually is. I can't change my lived experience, but I can try to change my professional experience so it's more community informed and engaged. I can also work to bring more folks into research who have critical lived experience within my community. Your community partners are very busy serving their community. They're interested in research and what research brings, but only to the extent that it ultimately results in better serving and improving the health of their community. Why would they do otherwise? I've highlighted in this presentation some value through publications because that's our currency in academics, suggesting that's possible, although the timelines and process and outlets might be different than what you're used to. Next. Why did I ask so many questions? Some of them are alluding to actions you might take, and some are harbingers of how your partnerships might be going. Because we're scientists, we're good at asking questions, and also because in doing multi-sector work, particularly with inequity focus, that necessitates you're asking yourself questions about yourself, your partnership, and your community, and how you're serving them. I listed a bunch of wishes that I had. If I were to start this over again, one, it'd be great to more easily build on existing community connections my organization and my research organization already has. It's not surprising to hear from me as a pediatric health psychologist that we need better and more diverse youth engagement to help with the next generation of PSE scientists. We need to better integrate community and research funding that understands the timelines of both that work so that together we can be more helpful. And we need to work on trustworthiness as research organizations. We need to take a systems approach to building community partnerships. How can a research organization become more community oriented? And how can I facilitate that growth? Thanks for listening. This is not my usual research type presentation that I typically give. And I'm eager to learn more from Deborah and from Melissa. Thanks.
Okay, thanks. Thank you so much, Brian. We're going to do questions, I think, for the panel at the end. So I'm pleased to turn it over now to Deborah, who's going to talk about her work and experiences in early care and education settings.
Great, thank you. Hi, everyone. Thanks for joining us today, and thanks for the opportunity to be here today and share with you a little bit about my experience working with early care and education settings. Next. In terms of disclosures, I did want to acknowledge various funding sources for the work that you're going to hear about today, as well as the main partners who over a decade have been working collaboratively on this research program. Next. So I was invited to talk a little bit about, the work that we do in early care and education programs. My work in childhood obesity has worked in a variety of settings. I've done some work in pediatric practices. I've done work in other sorts of community-based organizations like Girl Scouts and Boys and Girls Clubs, as well as K through 12 schools. And so, we know that, going where the kids are is really the best approach. And we know that, we want to start early. And, many children, 2/3 of US preschool children are enrolled in some form of center-based care, and children spend a lot of time in that care. Many meals, behaviors for life are shaped in that environment. And, what can we do earlier on to help establish those healthy habits for life? Next slide. So I'm going to talk to you about a project called Míranos. Look at us, we're healthy. So, children always want to show their new skills. It's look at me, right? Look at me. And so that's what Míranos means. It's look at me. And, what we've done is we've developed a program with Head Start programs in San Antonio. And Head Starts, of course, are an early childhood education program that was designed specifically to meet the needs of financially disadvantaged communities, to give them the same early educational opportunities for development as other children had. And so what we also were in an environment, which is San Antonio, Texas, which is a majority city. And so we were able to really focus in on a large Hispanic population that was attending the Head Start centers in this community to create this multi-level intervention approach. And so next slide. Our approach has really always been very community-centered in that we use participatory methods to engage the community in the design, delivery, and evaluation. So from concept formation, we're always trying to address barriers to engagement. How can we make it easier for the community to be involved and be an active member of our process and strategy? Always assets oriented. How can we build on what's already happening? And the structures that exist, and how can we develop and build on capacity there. Everything is done in collaborations and partnerships with community-based organizations. And we focus on, changing those conditions that drive poor health alongside the individual factors, and really want to transition like the ownership, right, of the initiative and the effort to the local community. So empowering the communities to lead these changes. Next. So I just wanted to kind of point out that this takes a long time, right? So this is kind of the research timeline for the project. So really it started back in 2005, and it was actually, we were invited to the table. The best way is always to be invited in, right? So the City of San Antonio Office of Community Driven Initiatives was very interested in investing in school readiness, how to get kids ready for kindergarten. And so they funded some community-based organizations that offer early childhood education. They also funded a couple of school districts, and the University of Texas San Antonio College of Education to work with these community-based organizations to really develop a strategy to improve school readiness. And at UTSA, this College of Education, that's where health ed and kinesiology were. And because gross motor development is also part of the curriculum, we were also invited in. And so it was really, it's been an emergent program, right? In that the program and the ideas for the program have evolved over multiple collaborations and in an iterative fashion over time, as opposed to, as mentioned in the previous session, right, an explicit pre-planned program where like, oh, these are the best practices and we really want to try to work with you to implement them. That's not really how it evolved. And so, from this one opportunity where we were invited, then when that ended, another opportunity presents itself. And this happens, it's very synergistic in the community environment. There was some Robert Wood Johnson Foundation money to promote childhood obesity. San Antonio was involved with Salute America, so there were some local resources. And so we approached our partners and said, would you like to continue to build on your program by having a focus on, establishing healthy behaviors? And we had already had some of these conversations. And so we were able to, bring in some additional resources to to focus more purposefully on healthy habits. And then eventually we had, we applied for our R01, where we did a randomized controlled trial, and I'll tell you a little bit about it. But this just kind of shows you, this is 15 years from beginning to the end of the trial. And also you can see there's gaps between 207 and 209 and 212 and 216. And there was a lot of grant writing that was happening during that time, but also continuous activities. So that we're always in connection with our community partners, responding to the kinds of things that Brian mentioned, right? Providing, helping them with grants, dissemination activities, showing up for guest, talks and these sorts of things. So always being responsive and present for our community partners. Next slide, please. So this is just to give you an example of how Míranos looked. We had 12 Head Start centers, and they were randomized into 3 conditions. One was a center-based intervention only, where we looked at changing policies and practices to be aligned with guidelines and recommendations, and providing training and technical assistance, professional development to the teachers and the staff to be able to implement these, as well as some supplemental health education curriculum that was adopted. Many of the strategies that we used with the center-based intervention evolved over time through this partnership. The new component was, how are we going to bring these messages home to the families, and how can we support families in making these behavior changes? So we created a parent, a home-based intervention. So we were testing center plus home to an attention control intervention. All of the strategies that we really used were building on what Head Start was already doing, right? Or what its obligations were. And so we would revisit, so say, for example, for parent education, Head Start has to conduct 2 home visits every year. It's part of their policies. And so we worked with them to say, okay, how do you, what do you do during these home visits? How can we integrate, healthy habits into these visits, and what would work for you, et cetera. So we try to build on what's already in their program. Next slide. So, one thing that you might have noticed in the last RCT is it did happen during COVID, right? So after all those years, like right in the middle of our trial, COVID hit. But, we still did learn a lot in the program, right? So, there was high fidelity to the intervention, right? We did work a lot with them to make sure we integrated it, right, into their everyday practice to make it easy to do, not something that was added on. So we did not see significant changes in weight gain, but we did see a trend in improved weight outcomes in the center plus home-based intervention. We did end up being slightly underpowered because we lost our second cohort in follow-up as a result of COVID. So we didn't have the sample size that we had planned for. And we did see some improvements in gross motor development, and parents reported positive changes in sleep and screen time. But we didn't see the changes that we were hoping for in diet and physical activity. And when we went back to revisit this, it was really about the environments that these families lived in, right? They lived in small environments, like small apartments. They didn't have a lot of space. They didn't have standing play equipment. They didn't have local parks nearby. They've high food insecurity. So it really shifted our focus. It's like, well, how can we make this happen if we don't address these resource issues that the families have? Next slide. And so we really felt like this next stage, we're really transitioning to be more intentional about how we can focus on the equity outcomes. We can skip this slide. Next. Thank you. So no, previous slide, sorry. Thank you. Yes, so this framework was mentioned earlier, right? The getting to equity framework, where you really have to, with intention, look at the communities, the populations, the settings that you're trying to impact. And as a group, we said, okay, well, why is it that this wasn't, parents weren't able to make these changes? And what can we do to level the playing field for them, right? And so we're really focusing now on how we can create specific interventions that address some of the equity issues that families are experiencing, such as food insecurity and some of the physical activity resource issues that they're experiencing. And so we'll be adopting a MOST strategy where we'll be combining the center with various equity-oriented strategies and testing various combinations in order to determine which ones to proceed with. Next. And so when we're talking about community engagement across these multiple sectors, one is, engaging in strategic partnership has always been super key in that, we're setting the goals collaboratively together. We're creating the plans and making sure that our strategies align with their reality, their everyday practice. We communicate often and consistently. We meet regularly while we're planning and implementing. We always feed them. It's really, we start small, learn and grow together. So we're co-creating the program. We're also very mindful of the organizational culture and work. Every CBO had a different way of communicating, a different leadership style. So respecting how they practice and operate and working within that. I mentioned much about building on existing infrastructure, on the assets and capacity that they already have. And then staying engaged between funding cycles and, saying we can't do the whole thing, but what can we do to kind of learn some more or strengthen what we're doing together? The other thing is providing community the resources they need to participate and succeed, right? So funding for staff time and training, providing the technical assistance, material resources. Many of these centers didn't have, enough play equipment, didn't have some of the, the books and things that they needed in order to implement the program appropriately, and help them achieve their goals. I always ask them, if we're going to do anything like a community assessment, is there anything that you want to know about your own organization that we can add to this assessment so that it can inform the work that you're doing, right? How can we modify this curriculum so it can help you achieve your performance standards, right? So always helping them move their agenda forward, and meaningful and consistent community engagement is critical. Next. And just kind of reflecting in terms of some of the challenges I think that we experience is the resources to establish and maintain these community collaborations. You have to be scrappy, you have to be creative, you have to figure out how to piece things together to keep the momentum moving. Also, when you're working with disadvantaged communities, sometimes you have to have higher investments, right? They need a little bit more materials and resources, and it makes it difficult to do this work sometimes within the budget caps that we have. And then the other thing I feel is, we have these cohort studies that have been going on for decades that are continuous, but somehow for intervention researchers, we haven't been able to figure out how to use that continuation mechanism. Every time you go to do a new project, you have to be innovative, have something different or new, and it causes some of these gaps in funding. So it'd be nice to be able to figure out how we can continue to evolve in these continuous kind of iterative ways. And the next slide. And just acknowledging that there's so many people over the years that have been involved with me in this work. And I want to thank them, and I'm happy to represent them here today.
Thanks so much, Deborah. I'm going to turn it quickly over to Melissa because we're running a little bit behind here. So Melissa, take it away.
Thank you. Thanks, Deborah and Brian. Great presentations. My name is Melissa Laska, and I'm here from the University of Minnesota. I'm here to talk about collaborations that we've had across different sectors, particularly with local government, community, food retail, and the like. Next slide. A lot of my work, just for context, a lot of my work over the last couple of decades has really centered on this idea that we have really well documented inequities in who has access to healthy food and who doesn't, particularly with underserved and marginalized communities lacking access and resources and carrying really a heavy burden of the chronic disease burden in this country. Next slide. And so a stream of my work that I'll highlight in some of my examples here today has been around small food stores and their ability, capacity, desire to stock and sell healthy food in communities that need it. And so we've had a lot of different strategies, particularly over the last decade or two, thinking about how to bring healthy food into communities that lack it. And one strategy that I've really focused on is how do we invest in retailers that are currently on the ground, currently already invested in these communities, trying to do their best, in many ways are part of these communities, in addition to potentially bringing in external vendors and retailers into communities. Next slide, please. So I'm going to walk through a relationship building timeline that I laid out in terms of our relationship with local government to improve healthy food retail around this specific line of research. I really had to tailor this into this one relationship, because to kind of put all the things that happened during this timeline, it would be too much to fit in this presentation and on this slide. So this is a very narrow view just to kind of walk through the timeline of how our partnership with local government came to be. It started in 2007 The Robert Wood Johnson Foundation had just a couple of years prior funded healthy eating research, a national program of RWJF. Mary Story had charged a number of groups with launching working groups through HER, one of which was the Healthy Corner Store Working Group, which Joel Gittleson and I led for many years. It was a group of researchers across the country really coming together in this new and growing area of small food store intervention, trying to understand and add to the science of how to advance public health. And over the next couple of years, really over the next 10 plus years, this working group produced a number of cross-site studies that tried to lend themselves to really formative work of understanding what's happening in these stores, challenges that retailers face, how we can overcome some of these challenges, impacts of policies on these kinds of retailers. But early in that work, so within a couple of years of launching that working group, when some of our first publications were coming out, Minneapolis Healthy Corner Store program began, run by Minneapolis city government and the health department here. It was similar to a lot of corner store programs that popped up across the country during this time and after, providing technical assistance to store owners to stock and sell healthy food, addressing distribution issues, addressing demand issues. And this effort was largely in Minneapolis supported by state funding through the statewide health improvement partnerships funding provided by state legislature. At this time, because Minneapolis was beginning the Healthy Corner Store program, they reached out to me in light of our similar interests to try to find areas of overlap, whether it just be information sharing and kind of data sharing, or whether it be more than that. And we spent a number of years just meeting and talking and connecting and building rapport. Next slide. Which was really important because that meant that in the very beginning of 2013, when one of our council members here in the city of Minneapolis started calling meetings to write a staple foods ordinance bill, I was in the room for those conversations, and I was able to be kind of just embedded in the partnership that helped give life to that bill. Next slide. If you don't know what a staple foods ordinance is, it is a local ordinance in our case that sets minimum standards of stocking of a variety of healthy foods, which were adapted from our Minnesota WIC minimum stocking standards for WIC authorized retailers. And it operated through business licensing, whereby if you were licensed to be a food store in the city of Minneapolis, which included convenience stores, corner stores, gas stations, pharmacies that wanted to sell food, dollar stores, all of these stores had to be licensed. Then you had to meet these minimal criteria for stocking and selling healthy food. And in large part, these the need for this kind of ordinance, it came to be because of the voice of community residents and community organizations saying, look, we have these small stores in our neighborhood, but they're not stocking any of the food we need to feed our families. How can we address this? And so I'm not going to get into kind of the study design or the findings that came out of studying the impact of this eventual policy. If you're interested, there's a citation at the bottom of the page here that looks at our primary outcomes, but I'm going to focus more on the process and the partnership in this presentation. Next slide. Because I was in the room at the time when the city council members started calling these meetings to write his bill, I was able to quickly act with my team and submit a time-sensitive R01 application to NIH, and then also acquire pilot funds in very small pots of money to try to get some formative work off the ground. Next slide. And then a whole bunch of stuff happened. The city hosted listening sessions and partner engagement and industry talks to get into specifics as to what this would look like and get buy-in for this kind of policy. We were part of those discussions. We did not lead those discussions, but we're part of the mix. We did lead some very, very fast-paced protocol development, retail surveillance. We were out in the field looking on everyone's shelves to try to make sure that we were informing the language that would be included into the specifications of the bill, that it appropriately addressed what we wanted it to address in improving healthy food access in the city. And so that all happened within the span of a few months. Unfortunately, our time-sensitive R01 submission was not funded. It received a very competitive score, but it wasn't funded. What was a benefit to that is the council member had thought that he would be able to introduce the Stable Foods Ordinance early in 2013. And in fact, through these discussions, came to realize there was more buy-in and more discussion and more planning that was needed. And so the introduction of the bill got kicked back for a year. So we were able to then submit a regular cycle R01, and the bill was introduced then later in 2014. We had to collect baseline data in large part before the ordinance was passed. We knew that our R01 had received a competitive score, and then at some point during the baseline data collection, the R01 was on the cycle to have been funded, but NIH put a hold on it, so as not to fund it unless the policy passed. And we kind of had to stick our necks out and say, well, are we just going to go ahead with institutional pre-award spending and assume this is going to pass? And we did do that. City Council voted, approved the ordinance, and R01 funding began. Next slide. It continued for the next several years, and we had ongoing engagement, I will say, throughout this time leading up to the ordinance, as well as continuing through our evaluation and in the years following with an active advisory board in terms of sharing data collection, sharing findings. We were engaged with community organizations, we were engaged with retailers. So really this is just highlighting one narrow aspect of the partnership. Next slide. My lessons learned from this and from a variety of other processes that we've gone through working across sectors is the idea, first and foremost, is the idea that progress is made through a lot of small steps, and R01s, or large-scale grants, large-scale evaluations, are built on many years or decades of prior work. And we've seen that. I mean, I illustrated that with my example here, where the partnership was 12 plus years in the making, but we heard that with presentations that, for the last couple of hours, that these are really slow and steady, progressive kind of things that build up over time, but certainly not in a 5-year grant cycle. In my experience, critical elements for the success of this kind of work included very large upfront and ongoing time investments in rapport building, in listening, in figuring out where community is at, in figuring out what community or government or retailers need, and where they're willing to go. And in many cases, it's really hard to know where that time comes from in terms of funding. Our institutions from an academic perspective often aren't set up to fund that kind of time investment for academic researchers, at least in my experience, they're not. And so that creates a variety of challenges. Also critical is funding for data collection in the years leading up to that R01 or that big kind of grant evaluation. We really need formative research funding and also process-oriented research with more proximal outcomes that often just don't seem to fly in our traditional NIH style grants, where when I say proximal outcomes, I mean things linking to systems change, but not necessarily individual health outcomes. I think there's been this idea for a long time that you need a little bit of formative funding, and then you can jump into something like an R21 to pilot an intervention, and then you can jump into something like an R01 to test the full impacts. And gosh, we know that just doesn't work. There are so many steps that are needed in building up the formative work, step after step after step. And through this formative research period, that's also rapport building, it's trust building, it's giving back to the community, understanding what they need from an evaluation and giving data back to them and finding out what they think about it. We need support for investigators. We need support. We benefited from training grants, T32s and the like, which helped us really staff some of the early work that we did before larger scale funding came through. But most importantly, and maybe this should have been at the top of the slide, is support for non-university entities. The organizations that we work with need support. And for a long time, we've asked them to come to the table with very little funding, if any funding at all, to plan and prepare and launch some of this work before the big grant funding comes in. And that's just not right. If we value these things, I think we need to fund organizations to work with us. In the case that I presented here, local government was reasonably and steadily, consistently funded. So they had a steady source of funding from the legislature. But for a lot of the community organizations that we work with, they're working on funding for next month or next quarter. And to come in and tell them, well, in a few years or in a decade, we could get really big research funding to partner with you. They might have the desire to partner with us, but they just don't have the ability because they have to be thinking of their current needs. So we really need funding for non-university entities. Next slide. In terms of time-sensitive research, I think when we got the NIH time-sensitive R01s, that was a major move of progress in the NIH funding world. And I know I'm being very NIH-centered here, but that was really a big accomplishment. However, those grants are very hard to get. It is difficult to get through that funding cycle, get funded on the first time with no resubmissions needed to get researcher or to get reviewers to buy into the idea early on without having to go back in for a resubmission. We also need flexibility and funding for pre-policy data collection. I was lucky to be at an institution that allowed major pre-award spending, but even so, I had to really stick my neck out to use it when NIH held my funding until the policy was passed. And I do want to point out that when you're working across sector, to some extent, everything is time sensitive, right? Even when you're not dealing with a policy or a program that's ready to be launched, communities have to think about what's in front of them. And staffing changes, leadership changes, priorities change. And so again, everything has an air of time sensitivity in a way that traditionally we just maybe haven't had in the research sector. Next slide. So really quick, I just have a few thoughts on to better support meaningful cross-sector and certainly multi-sector research. I'm focused really on these system level changes that need to happen. I think we have a lot of lessons learned that we heard about earlier that I wholeheartedly agree with about how individual researchers need to come to the table, how we need to show up, how we need to have humility. We also need funding to do a lot of these things and to support our collaborators across sectors in joining with us to do this stuff. I brainstormed with my colleagues here about possible example mechanisms that could be used, again, with a heavy mind toward NIH, but certainly there are ways that we can have these cross different institutions. PCORI is one example of an organization that's been funding engagement awards that really have this idea of formative work in mind in a great way. I think we need to think about investigator focus awards where not just early career awards, but also more mid and senior career awards, where people are funded to do the work that develops an idea or develops a collaboration and accompany that with funding for the organizations we're working with. Next slide. I think there's important considerations for grant review processes. As reviewers, we all need to kind of get on board, I think, with the relatively big picture. And we need to be educating ourselves and our colleagues about how many challenges and limitations there are for this type of research. Just because there are these limitations in place does not mean the work is not worth doing, but you do need to kind of embrace the limitations and move forward with it, or else the opportunities and the collaborations will move on for you. We have some new NIH review criteria coming down the pike, which will be really encouraging to hopefully put a focus on importance. Next slide. And there's important responsibilities for researchers, really to put forward the grants that we think that are important to advance work, regardless of what's kind of traditionally been funded by funding organizations. What do we think we need to do to move the work forward? And finally, we really, as academics, we have to reevaluate promotion and tenure standards and the implementation of those standards in order to support success among our early career investigators doing this kind of work. Final slide, I wanted to acknowledge some of the funding that we got. There's a lot of people that were involved in this work, too many to name. Really a lot of sectors coming together to try to advance the public health. And I appreciate the collaboration from all of them. Thank you.
Super, thank you so much, Melissa, Brian, and Deborah. That was really informative. I think we have time for about 3 or 4 questions. So we've had a bunch come in. Brian, I'm going to start with you. Specifically, you made some great points about partnerships. Have you included in your initiatives a specific process for asking individuals or organizations about which partners they need to do their work and connecting them to partners and tracking the network of partnerships? We heard earlier this morning about, network analysis and things like that. Curious about, the extent to which you've leveraged in that space.
Yeah, the network analysis is brilliant, and I've not done it. And we should be doing it, right? In order to understand how these things happen. To me, a lot of this stuff has happened organically. So, I'm in a partner space where they're talking about their broader work that doesn't have to do with our specific engagement. I'm like, oh, I know someone that does sort of evaluation and research in that. I'm going to connect them. How can I do that? How can I facilitate that connection? And then, that happens, and I do that warm introduction, and they take off. And then I hear about it from my colleague as well as my partners later. And again, it sort of goes back to that small world comment that I made before of, wow, there's so many community-based organizations, at least in our community, but they know each other and they know their partners. And so that's been really sort of valuable for our research folks as well as for our partners to make those connections. But I was not smart enough to anticipate, I should keep track of sort of how that evolves and evaluate how to make it more robust. But it happens a lot organically.
Thanks. And Melissa, I'm going to just tag team on this here a little bit. We had another question come in asking if you could speak a little bit to the supports you had to engage in relationship building for the 6 years prior to your R01. I think it dovetails nicely on what Brian was just talking about.
Yeah, so engagement was largely just to some extent, very, very small grants that we could leverage to produce some planning work and some formative work. To another extent, you just find time to make it happen, funding off of, I dare say, other projects that end up just, squeeze time out of wherever you can. And unfortunately, this does put a big strain on all the parties involved, particularly when you're going beyond the bounds of what you're currently funded to do. But you just kind of make it work. I wish I had a really good answer, and I don't. Oh, Jamie, you're muted.
Thank you. Deborah, here's a question for you. I know you sort of answered this already in the Q&A, but I want to delve a little bit deeper here. One of the questions that was asked for you, it feels like we're doing a lot of pilot work in this space, and especially in the community work that can often have a significant impact. Can you talk a little bit more about, ways we can accelerate some of this work in this space and move beyond just pilots, as well as, how can we leverage all these mini pilots into sort of bigger studies, right? I mean, that's the problem. Melissa talked a lot about, I thought Melissa's timeline was phenomenal because it really illustrated the reality of doing this work. And it's, you know, step by step by step. And we're not in a position right now with our current mechanisms for doing anything other than the way Melissa described it. Oh, you're muted now, Deborah.
I was going to say, and it's hard too, right? Because as researchers, you also want to try to publish these things or do presentations, right? So you want to do the work, you want to do a high quality, you know, pilot that can, you know, work for you in those spaces, right? And it's iterative learning, right? So it's a community, we're all learning and benefiting, and we feel like we're having an impact. I mean, it's almost at, you know, this whole RCT thing is like, you have to prove that you can do it in order to get funded to do it. You're practically already doing it, right? And so I feel like some of the new models, right? Like we're venturing into most, and I'm telling you, it's scary for me to go there because I've been like an RCT person for so long. So wrapping my mind around how do these optimization strategies work, or implementation science, right? And it's really about thinking about things in a different way. And the challenge is that just as, you know, researchers, we're learning how to use these new models and tools, the reviewers are learning how to evaluate them too, right? So I think that there's potential in, you know, some of these new approaches. But yeah, it's just like the current way that, you know, these things evolve over time takes a lot. And being creative with resources, right? I think one advantage is once you become a little bit more senior is you have pots of money, right? Like either IDC returns or an endowed chair, or, you know, centers would have pilot funds, and you can do a lot with small amounts of resources, but student projects as
Thanks.
well.
If I
So,
could just add though, can I add one thing?
yeah.
We've been making do with really small pots of money for so long that I guess I am getting tired of shortchanging the work and shortchanging my collaborators elsewhere because I have to do something on a shoestring budget. And so I just want to push a little bit on that we can make it work, and we have made it work, but we have not always done a good job at doing it, in part for a lot of reasons, but it's some of it has to do with like we're trying to squeeze everything we can out of a $10, $20, $25, $50,000 grant. We're trying to do an R01, you know, and it's really hard to make ends meet.
Thanks. And one thing, I'm just going to throw this question out here, and we literally have like 1 minute. So, you know, I'm curious about the extent to which, Deborah, you mentioned most design implementation science, right? I'm curious about the extent to which any of you have applied for implementation research funding, D&I funding from NIH, because a lot of the measures that the community partners are interested in are the implementation outcomes. They're the process measures. Whereas NIH, the time sensitive, the biggest challenge is you have to have objective outcomes on health impacts, right? And so, you know, is there a happy medium here where we can get some of the things that the community organizations need and decision makers need through the implementation outcomes, and then also secondarily measuring the health outcomes? I'm just curious if any of you have gone that route yet.
In my studies, I do typically include an aim for implementation, but I always have to include, you know, like a hard outcome, right? As the primary aim. And then usually my implementation aim is second or third. And I haven't gone like full implementation science only. Yeah.
Thanks.
I do want to give a shout out to the CDC PRC network that just started its next cycle of funding, where everything will be focused on D&I, or at least the core projects will. So it'll be really exciting to see kind of where that goes.
Very much so. Well, with that note, I think we're going to end. We're out of time, and I'm going to turn it back. Thank you all so much. This was super, really appreciated, really hearing real world experience in the research world in terms of lessons learned. And we're going to take that with us. So I'm going to turn it back over to Dan to move us to our break.